Hi everyone, today we're going to be talking about the differences and similarities between anxiety and depression.
Oftentimes, I think of anxiety and depression as two sides of the same coin.
I tend to get away from the labels of anxiety and depression despite knowing very well personally what they are, as I have suffered both from bouts of anxiety and depression. But people tend to present having diagnosed themselves or maybe coming with a diagnosis from a therapist like Breanna and will want help. And so there will tend to be the patient who knows I'm a little bit more of this than the other, but often there are signs of each where somebody might be a little bit more future focused, someone else might be a bit more past focused. So this future and past thing totally holds in terms of what I do with people. In fact, I was thinking about our kids today. One seems to be more of a what if kind of kid. What if this happens? What if this happens? And I can totally connect with that part of my mind that has done that a lot of my life in thinking about what's going to happen next. But when there is a little bit more of a review of what's been going on for a long time, feeling usually not great about things that have transpired, whether it's traumas in our families or our lives or something like this, a constant review of what I should have done. The shoulds come in. I should have done this. I should have done this. It could have been different. And so in my clinic, I will certainly do some talking, but talk therapy is not what I do. I will advise them to do some self-care habits, meditation, movement, acupuncture, in the way Chinese medicine views this coin. And there's these two sides to the coin, one being a bit more future-centric, one being a bit more past-centric. But these are both tensions of really non-acceptance. Non-acceptance of what's to come and the fact that you can't control those what-ifs. Mm-hmm. What if's going to happen in the future? What if an earthquake happens? A tension of non-acceptance of what has already transpired. Should I have talked to that person quicker or in a different way or done a different thing to that person or family member or whatever it is? And this tension is really where these things meet in the middle of that coin. And so I tend to guide most patients away from it's more future or more past, and there are those tendencies, which is why those diagnoses show up. But I tend to pull them away from the label and focus really on that tension that connects the two. And yes, focus on as many present moment, here and now, mindful activities like spending time in nature, simply focusing on really boring things that sound boring, but they can be a meditation, which is the activities of your daily life.
Yeah.
Where you continue to repeat to yourself, I am now brushing my teeth. I am now feeling the warm water on my hands. Once you get used to that, maybe even adding a word or a mantra to your day. I will often do that when I find myself preoccupied with things that I know I shouldn't be thinking about. And I'll take an invocation or a paragraph or a sentence that's close to me and put it slowly on repeat so that I can nourish myself with these words as opposed to those shoulds that get me reviewing the past or the what-ifs that get me afraid of the future.
Using the mindful activities, really trying to find ways to ground yourself in the present moment, and you can return there, if you find yourself going backward or forward. And when we're aware of what we're feeling in the moment, we're better able to set boundaries. A lot of times when we're not asserting our needs or taking care of ourselves in the relationships, that's when we can really ruminate on interactions afterwards, pick ourselves apart, pick the other person apart, feel, guilty or resentful. Being in tune with our emotions and setting those really healthy boundaries allows us not, to avoid that cycle, and also avoid feeling anxious. And, a lot of times when we're anxious about situations, we're trying to gear ourselves up to deal with anything that may be uncomfortable or difficult in the moment. So we're, going through scenarios or trying to kind of build ourselves up for that.
Can you speak a bit more about boundaries? What do you mean by boundaries helping with anxiety or depression? Setting boundaries with other people or setting boundaries with yourself?
Setting boundaries with other people, and I define boundaries really as taking care of yourself in relationships by really being clear on how you're feeling and being able to verbalize that in relationships. Oftentimes people get stuck in boundaries, meaning, oh, I need to say this in order to change someone's behavior or point out their behavior in order to kind of change the situation. But we can rarely, we're never successful with that. That is a really difficult thing to do, change someone else's behavior.
Right.
So the goal is really for you to notice how you're feeling when you're interacting with someone. And if they say something to you and you're having a reaction or a feeling, being able to go inside and check in with yourself and then saying, this conversation doesn't feel good right now.
You're talking about relationships
Right.
now and how that can generate anxiety. But what if there's somebody by themselves in their own head and mind with nobody else around them and they're suffering? Is this boundary practice going to help them in that moment?
Once you have access to your feelings, then you can kind of look at, now what do I do with them? Do I want to use this coping strategy? Do I want to talk to a friend? Do I want to journal write? Do I want to go for a walk? How do I take care of this particular feeling? So it does work. Thinking about a river. When we're getting kind of stuck in anxiety or depression, I see it as you're either holding onto a rock and not allowing yourself to be moved by the current, or you're being moved by the current and bashed all over the rocks and you're, hitting sticks. If you allow emotions to flow, they are ever changing and they're ever moving. So teaching yourself to relax into experiencing your feelings without getting caught up. One way to do that is journaling for deeper insight into what you are feeling. A lot of anxiety and depression is resistance of feeling or getting stuck in certain feelings. A lot of times when you come into therapy, the therapist is asking questions that are supposed to spark insight or deeper reflection. If you're only in that space for 1 hour a week, you kind of engage with your therapist and you have that conversation, but then you go about your life and you completely shut off that part, you're not really progressing or benefiting all that much. So if you are, going to therapy and your therapist is asking you these kind of questions and then you leave and you're continuing to ask yourself the same kinds of questions. Why do I continue to get in these relationships that feel really toxic? Why do I continue to overexert myself even though it hurts me physically? Why, these kind of questions. And then when you come back to therapy, you have a little bit more insight and you have some things that you've sort of looked at during the week. I don't know about you, but I tend to see clients moving faster when they're doing the homework, using their therapy sessions or their appointments with you as a jumping off point to go deeper in their own spaces.
Being accountable to a professional is helpful, but being accountable to anybody can be helpful. So often I will enable someone to find someone else at some point to be accountable to.
Right.
Whether it's a friend or a family member or complete strangers, as far as finding communities online or support groups.